Diabetes is a condition that affects a person right from the top of your head to the bottom of your feet. So similarly, it affects the eye from the front of the eye to the back of the eye. So most commonly, it tends to cause problems with the retina. So you can have abnormal blood vessels growing at the back of the eye. You can have bleeds inside the eye. You can have swelling in the retina. You can sometimes develop cataracts if the sugars are not very well controlled, eye inflammation. You can develop raised intraocular pressure. So these are a few of the complications of diabetic eye disease that a diabetic can face in their lifetime. Most common diabetic retinopathy doesn't have symptoms until it's quite late. So for that sole purpose, we have a program which is available in the United Kingdom, which is called Diabetic Eye Screening Program, where a person who is diabetic will be screened for diabetic eye disease every year. And they will pick up if there's a problem and they will refer the person to the eye clinic. Most often, by the time you notice symptoms like blurry vision or floaters, then you're already quite way down the road of having a moderate to advanced diabetic eye disease where you don't want to be. So those are that's how long it can take. And sometimes, depending on the diabetic status of the patient, it can happen very soon as well. Most often when I see patients with diabetic eye disease, I usually spend more time talking to them about their diabetic care. What support are they getting from their general practitioner, and talking to them about their diet, their fitness, and their understanding of the diabetes. So that's the foundation I like to build with the patients that I care for, because that sets the baseline for everything that will happen in the future. The next step is then taking out some photographs, doing scans, then sitting with the patient, looking at these together, helping them understand how their diabetes is affecting their eye. So they then are in a situation where they take ownership of what's happening to them. Then, depending on the level of diabetic eye disease, then we then have a conversation. Do we do or just continue with observation? If I feel that the patient is going to take ownership of their diabetic care and look after themselves, I usually will say, look, I will see you in a few months and you take better care of yourself. And some of these things are reversible. If I feel that's not the case and the patient may not be very good at attending the clinic, I may decide to do some retinal laser. If it is quite more advanced, and if they got quite bad swelling at the back of the eye, then I may decide I would like to do intravitreal injections of anti-VEGF or intravitreal injections of steroids. If it is even further advanced with new blood vessels at the back, then I may have a conversation about, I think it's time to do laser treatment, which is much more aggressive, much more widespread at the back of the eye. And that needs another bit of conversation as well, because everything we do to the patient and the person has some side effects. So those conversations need to be had. But the end of the day, what I want is the patient to have a good journey, good outcome, good result with minimal intention. That is always my intention itself. Sadly, yes, diabetic eye disease can lead to blindness, and it does happen even this day and age. And I feel very sad when that happens to any of my patients. That means I probably haven't given them enough attention and care. Not always, but usually I can sort of predict which patient is going down the route, and I try and get them as much more support as possible and advise, if I can, in helping them with their diabetic management. But yes, patients can lose vision and be vision impaired if they are not careful with their diabetes as a result of diabetic eye disease. Diabetic eye disease can be reversed if it is caught in the very early stages. So if you get a report from the diabetic eye screening program saying you got the early stages of diabetic eye disease and you take the action to look after your diabetes, then usually it is reversible in those early stages. After a certain point, it will probably not get any better, but what you don't want is making it worse. So even if it's if it's advanced, you can stop it from getting worse by looking after yourself and managing your diabetes much better. You can't reverse it, but you can stall it from getting worse.